Hi, everyone. Good morning, good afternoon, good evening to you, wherever you are in the world. My name is Rita Badiani, and I'm the director of E2A, the Evidence to Action Project, which is USAID's global flagship for strengthening family planning and reproductive health service delivery. On behalf of all the organizers of today's event, I want to thank you for sharing your time with us, especially amidst a worldwide pandemic. We hope you are joining us today in good health and that you remain so. Now, focusing on today's event, which I am really excited about. We are going to dive into a technical area of extreme importance, not only to E2A, but to the future of our global health community. When we talk about driving the next generation of family planning programs, we must talk about working at scale. Here at E2A, we believe systematic scale-up is one of the keys to achieving global family planning goals and ensuring women and girls across the world can access the quality services they need. For 9 years and across 17 countries, E2A has partnered with governments, local NGOs, and communities to increase support, build evidence, and facilitate the scale up of what works for improving family planning and reproductive health outcomes. Before we go any further, it's important to say that our conversation today will focus on systematic scale up as defined by EXPANDNET. As you can see on the screen, systematic scale up is making deliberate efforts to increase the impact of innovations successfully tested in pilot or experimental projects to benefit more people and to foster policy and program development on a lasting basis. From the beginning, E2A has worked hard to adopt a scaling up mindset. We actually began this transition when scaling up thinking was relatively new, and a lot has evolved since 2012. Uh, Reflecting with our team about those early days, it was clear from the start that this new way of thinking and working wouldn't be that easy. Scaling up systematically is often hard. Despite the challenges, we achieve important gains in collaboration with our technical scale-up partner. Today, you'll hear from E2A partners as well as other experts and implementers who are ready to share their hands-on experience applying systematic approach to scaling up family planning best practices in multiple countries. Laura, Regina, EMC, Alexis, and Trish will share what worked well and what did not. Over the next hour, we hope you will learn from our experience, understand better this complex process, and master useful tips for systematic scale up. That means learning from your experiences too. E2A and EXPANDNET are honored to co-chair the community of practice on systematic approach to scale up of family planning and reproductive health best practices. And I see many COP members are here today. Thank you for joining us for this webinar. For anyone interested in becoming a member of the Systematic Scale-Up Community of Practice, you can sign up via the link in your Zoom chat window. We will also send this link to you after today's event. Before we move on to hear the presenters, a few reminders. Given the large number of people on today's call, we have muted our participants. However, we do encourage your participation, and please, throughout the event, share your questions and comments by clicking on the Q&A at the bottom of your Zoom screen. Now, without further ado, let's get started. And I am pleased to introduce Laura Guron, who will moderate this webinar. Laura Guron is a Scale-Up Advisor for E2A, President of Partners in Expanding Health Quality and Access, member of EXPANDNET'S Secretariat, and co-lead of the COP on Systematic Approach to Scale Up. Laura has collaborated with E2A on the application of Scale-Up approach since the project inception. Thank you, Laura, and the floor is yours.
Thank you very much, Rita. As Rita explained, E2A began more than 9 years ago when the field of scale-up was young and capacity to work systematically on scale-up was not widespread. Since 2003, EXPANDNET has served as a global network of public health and development professionals seeking to advance the science and practice of scale-up. We've watched with great interest and excitement how the field of scale-up has grown over the last decade. A paradigm shift seems now well underway because many health and development professionals are recognizing that it's no longer justified to continue investing in endless small-scale projects, ones that are not expanded or institutionalized, nor sustained where implemented. Some of you listening may be new to scaling up, and others may have focused on the issue for years. But the 500 plus people registered for today's webinar are evidence of a sea change, and I believe you're here because you recognize that we can do more to benefit our populations. E2A, Pathfinder, and EXPANDNET are part of a growing group of projects and organizations who have realized that a narrowly focused project approach, in contrast to a more holistic program approach, is not helping us achieve our goals. The project approach, as defined by Chianzo and colleagues, are interventions that are focused on short-term results and not necessarily on what's needed to ensure sustainable scale-up, even though large-scale impact is often stated as the ultimate goal. In this approach, levels of financial, technical, and human resources are used even though unlikely to be available for subsequent large-scale implementation. In contrast, a program approach focuses on developing, testing, and scaling up interventions that are aligned with and build on the implementation capacity of existing institutions. And they're in keeping with their aspirations, plans, and programmatic frameworks. The tendency to want to demonstrate success among projects can be understandable, especially in the face of global health emergencies like HIV or now COVID. But we know that if one doesn't apply understandings about what works for scale-up, then our efforts are less likely to be effective, our energy and resources are be wasted, and will not achieve the outcomes and impacts we hope to see. Many projects by donors, technical and governmental and non-governmental organizations have been helping shift the paradigm. Increasingly, investments avoid the project approach and instead use a strong system strengthening scale-up focus, what we've been calling a scaling up mindset, and which Regina will address in describing how E2A accomplished this. USAID, for example, has funded several initiatives where the focus on scale-up is explicit, like the Maternal and Child Survival Program, the Newer Momentum Agreements, Research for Scalable Solutions, and more. Other funders of global projects have also taken the scaling up mindset very seriously. For example, MacArthur and Packard Foundations and the Gates Foundation projects. These are extremely important developments for our field that we hope to see more of, as we believe that this is the only way we can hope to achieve sustainable quality improvements and the SDGs more broadly. This movement is not limited to the family planning, reproductive health, or even global health fields. It spans other areas of development like education, rural agriculture, and more. And the closely allied field of implementation science is increasingly spotlighting scale-up as a critical component. Each of us has a critical role in shifting the global health and development paradigm away from more conventional project approaches towards working with a scaling up mindset. So how do we accomplish this? Well, one way is to use what is known about scale-up success to shape efforts to introduce, expand, and institutionalize interventions. In EXPANDNET'S earlier years, we assembled learning from a wide variety of fields to develop a framework and approach for supporting scale-up. We wove in field experience of EXPANDNET members to develop practical guidance laying out key principles and attributes of success. In this slide, you see a trajectory for a systematic approach to scale-up developed by EXPANDNET, which recognizes that a scale-up mindset is required all along a project's trajectory. Here in phase 1, the focus is on testing interventions in ways that use what's known to support scale-up success to shape the project's design and throughout its implementation. Phase 2 then encourages the systematic development of a scaling up strategy, once results of local testing indicate this is appropriate. And phase 3 concerns strategically managing the scaling up process. This latter phase is often the lengthiest and can be the one where funding often drops off exactly when it is most needed. The slide also indicates that if one proceeds along this trajectory, it's both possible and necessary to build additional capacity to work on scaling up amongst more and more people. Please also note that documenting and disseminating scale-up learning to assist with the management of the scaling up process is critical. And these are both key points that will be addressed by our panelists in their remarks. EXPANDNET has created tools to support the hard work of scale-up, as hopefully many of you on the line already know. These practical tools have been in use for nearly 10 years and have stood the test of time. They're all available for download on the EXPANDNET and E2A websites, where one can also find a bibliography of scaling up related resources and publications. The two main tools most widely used in E2A activities were Beginning with the End in Mind and the 9-Step Guide for Developing a Scaling Up Strategy. We have the good fortune today of Dr. Yemisi Femi-Pius and Dr. Alexis Santibona to speak with us about how these tools were applied in Nigeria and DRC respectively. Several other E2A country activities also worked with a scale-up mindset, and in addition, successfully navigated 2 or 3 of the phases that I have outlined. E2A and our in-country partners have learned many lessons over this period, which we've assembled in technical briefs and peer-reviewed publications, again on the E2A website. Although E2A will be ending next year, happily Pathfinder is committed to maintaining the website as a resource for the future. Today's webinar represents an effort to distill learning from E2A's 9 years of work and to provide key examples of country-level applications of the tools. Little documentation exists for how large multi-country donor-funded projects have sought to explicitly address scale-up in their design and implementation work in countries. We'll be sharing some of the challenges of working this way, as well as where the successes hold promise for the future. There are three key lessons we want to highlight today, and our esteemed speakers will touch on aspects of each of these from their perspective. The first lesson highlights that because understanding of what works in scale-up is not universally held nor automatic, there's an urgent need to build scaling up capacity among otherwise strong technical professionals and implementers. E2A gained substantial experience in how to do this, and Regina Benevides, who I'll introduce in a moment, will discuss this. Lesson 2 pertains to the resource team, namely those who drive the scaling up process forward and without whom nothing much happens. Dr. Yemisi Femi Pius will talk about how a resource team was established in Cross River State, Nigeria, and how their capacity was strengthened for statewide provision of long-acting contraceptive services. Dr. Alexis Antabona will share learning from DRC, where he worked with a resource team to guide the piloting and scale-up of an integrated package of community-based services in 3 provinces. He'll talk about how in DRC the teams progressed through 3 phases of the systematic approach I outlined earlier. Of course, time is short, and unfortunately we can't go into too much depth on the country experiences, but for those who want to learn more, we'll be sending out some of these resources together with the webinar recording. Next, you'll be hearing from Trish McDonald, who oversaw E2A on behalf of USAID for its full tenure. Trish will reflect back on E2A's journey and how the sharing of learning across projects and at the global level has helped advance collective understanding of the field of scale-up. She'll leave us with parting thoughts of how we can keep building on the momentum that now exists. After we hear from Trish, we'll turn to addressing your questions in the last 15 minutes. We're hoping you'll use the Q&A section at the bottom of the Zoom screen to pose questions as they arise for you, and the panelists will try to address as many as possible. Now I'd like to introduce our first speaker, Dr. Regina Benevides, who was with E2A from its very earliest days and provided technical assistance for several applications of EXPANDNET'S systematic approach to scale-up. Regina's focus today will be on cultivating a mindset shift among the DC-based project team, as well as key learning from E2A's scale-up work in Niger. Regina has over 3 decades of experience working with country governments on adolescent and youth reproductive health, on gender, community-based education, and development programs. Prior to joining E2A, Regina served as the Director of Operations for Pathfinder in Mozambique and as Senior Technical Advisor for the nationwide Geração Biz program that addressed adolescent and youth reproductive health, HIV prevention, care, and treatment. All right, Regina, over to you. Thank you.
Thanks, Laura, for the introduction. Good morning, good afternoon, good evening, everyone. I'm Regina Benevides. I'm the Gender and Youth Team Lead at CDC, Center for Disease Control and Prevention, at the Center for Global Health HIV Prevention Branch. Before joining CDC, I was part of E2A's technical team for 6 years. So it's really a great pleasure to be in this webinar today. Thanks a lot for inviting me, because I want to share with you what I learned from having participated in the E2A's project supporting scaling up efforts. I do believe that scale up is a pillar for any public health intervention, and it remains a big challenge. My focus on this webinar is how E2A's technical team started the project. Since E2A began in 2012, its mandate has been to help test or scale up best practices in family planning and reproductive health, service delivery for women and girls. We had a very capable team with different backgrounds in public health, but it was the first time that we were being challenged to support countries and regions with very different interventions, but with an explicit mandate to use global lessons for scale. We, as a technical team, were initially unfamiliar with developments in the scaling up field. Thus, a key first step was for us to gain exposure to EXPANDNET'S systems building systematic approach and related tools, and to begin to shift away from this linear project thinking that start with a pilot and end without a clear understanding of how to expand the project to new sites. EXPANDNET provided support by conducting a series of seminars to capacitate the technical team in scaling up principles derived from a range of literature, including organization and management science and diffusion of innovation, as well as lessons learned from international scale-up experience. Although very helpful, the early seminars were necessary but insufficient to fully equip the technical team to support application of the EXPANDNET WHO framework and tools at the country level. EXPANDNET members continue over the next several years to build the capacity of E2A's technical team through mentoring and jointly facilitating country level planning exercise, delivering scaling up workshops, and supporting scaling up analysis and documentation efforts. With this exposure to new ways of thinking that were being met with demonstrable successes, a new mindset and growing technical capacity, the E2A team began to have significant impact in shifting country-level activities from conventional project approaches to a more systematic focus on scale-up. Nevertheless, sometimes the mindset shift among E2A colleagues was slow in coming up, and in some instances, it didn't even succeed. This was most often the case where E2A's technical support role was peripheral. For example, when an existing project was already approved and underway by the time E2A was invited to collaborate. Achieving a shift towards a scaling up mindset took time and continuous attention. This mindset implies the recognition of the importance of applying a systems perspective that fits the broader national agenda in selecting, designing, and implementing interventions. Ensuring government and other local stakeholders take ownership of the initiative. Making certain that activities and investments contribute meaningfully to the national program, and building local capacity to support scale-up and limiting external inputs to what can be maintained or mobilized when implementing on a larger scale. We learned. What did we learn? We learned that political and institutional commitment and ownership are critical to support the vertical dimension of scaling up. We also learned that funds, technical capacity, and engagement of communities are critical to support the horizontal dimension of scale-up. But what I think is the most valuable lesson learned is that to take a sustainable scaling up approach requires a mindset shift. I mostly clearly saw this happening through my experience with E2A's University Leadership for Change, ULC, project in Niger, where we built a sexual reproductive health youth program with the involvement of young university students, health providers, the government, local and international organizations that had used EXPANDNET'S methodology since its inception. The ULC project was designed as a model with the potential for scale up to other universities in Niger, as well as other universities across West African E2A made deliberate efforts to plan for scaling up in a systematic way using EXPANDNET tools so as to increase the ULC approach's scalability. As you can see in the arrow, a fair amount of E2A's work was in the first two phases of scaling up, namely beginning with the end in mind and developing strategies. Phase 3, management of scaling up, was more difficult to follow up due to the end of dedicated funds that could support technical assistance to the country. However, and this is the most important part, because ULC approach was already institutionalized at the government level, E2A was able to support the adaptation and scaling up of the approach for use at rural communities in another province in the country. Our technical team also confirmed that a commitment to systematic scale-up implies building sustainability. A first lesson learned in the Niger project is that a participatory stakeholder involvement since the inception of the program is essential for sustainability. A second point is that process documentation with periodic validation from different stakeholders is key to build policies and to improve quality of program implementation. A third one is that we have to invest in capacity building. Capacity building on adaptation and scaling up of stakeholders, equip them to take the leadership of the process contributing to sustainability. Likewise, scaling up capacity is best built when technical assistance is provided in the context of real-time application. In countries where long-time EXPANDNET associates were based and could be mobilized to give local and regional support to E2A's activity, as in Niger, DRC, Senegal, the work benefit greatly. Mobilization of local regional resources to support adaptation and scaling up process increase the likelihood of sustainability. ULC is a very good example of the elements that I just mentioned for successful and sustainable scaling. The program, which started in the capital of the country, became part of the Niger National Youth Policy and was adapted to rural communities. Scaling up process was then combined with an active adaptation focused on developing local capacities to respond to the context-specific needs. Originally, many of the scaling up ideas were approached in a somewhat formulaic manner, but as all stakeholders started to see the consequence of a broader buy-in, a genuine shift in mindset occurred, and colleagues, both at headquarters and in the field, were able to integrate these ideas into their work. Thank you very much for the opportunity of sharing with you this experience. Back to you, Laura.
And sincere thanks to you, Regina, for sharing your recollections, your reflections, and your experience. As a reminder to everybody, please do place your questions for our speakers in the Q&A section at the bottom of the Zoom window. So now I have the pleasure and benefit of introducing Dr. Yemisi Femi-Pius, who's a public health physician with 16 years of experience in clinical.
Good afternoon.
Good. Let me introduce you, Yemisi. So you've worked on the design, implementation, and management of reproductive, maternal, and newborn health, family planning, reproductive health, HIV/AIDS, and tuberculosis programs. She's a senior technical manager for Pathfinder Nigeria Country Office since 2015 and has served as the state program manager for Cross River State, where she provides technical and programmatic leadership in expanding access to family planning, maternal and newborn health services, all under the E2A Saving Mothers Giving Life initiative. Dr. Yumisi is going to share with us some outcomes from the efforts to establish a scaling up resource team in Cross River State and the guiding of implementation and scale up of Nigeria's national task sharing, task shifting policy to enable family planning provision by community health extension workers. Okay, Dr. Femi Pius, thank you. The floor is yours now.
Good morning, good afternoon, and good evening all. I'll be presenting our experience with the scale-up activities in Cross River State. I'll particularly focus on the role of the resource team as we try to support the government of Cross River State to scale up some services in the state. A resource team is defined by EXPANDNET'S and WHO as individuals or organizations that seek to promote and facilitate wider use of the innovation. Now, this resource team is expected to have some competencies and some skills in training for the innovation, skills in strategic management, in advocacy, in research, monitoring and evaluation, in clinical support and supervision, even in resource mobilization. And so this was put into consideration when we're trying to build the resource team in Cross River State. Now, through the Saving Mothers Giving Life initiative under the E2A project, Pathfinder International provided technical support to the Cross River State government. Now, prior to that period, the Cross River State government had actually adopted the National Family Planning Task Shifting Task Sharing Policy, and they had been domesticated. It's important to know that the Task Shifting Task Sharing Policy was for all health services, but we're looking to support the state to domesticate the aspect of family planning and help them to implement that task shifting task sharing policy in the state. Now, the priority was given to identify and build capacity of a local resource team that made up stakeholders in Cross River State government who will own, they will lead and support the scale-up process. The Cross River State Family Planning Scale-up Resource Team was made up of members from the Cross River State Ministry of Health, the Primary Healthcare Development Agency, the Ministry of International Development and Cooperation, community-based organization in the state, as well as other implementing partners. The resource team was trained on the WHO EXPANDNET document for on the 9 steps for developing a scale-up strategy. Now, so the resource team developed a scale-up strategy for interventions that were successfully tested in the operations research. So prior to this time, an operational research had been conducted on tax sharing, by community health extension workers in family planning service delivery. That is, community health extension workers can provide implants by way of task sharing and task shifting to them to patients and clients that needed them. So the resource team developed a scale-up strategy for these interventions. And they also guided the efforts of the state to expand and institutionalize this task shifting approach. And some of the activities that they supported was to increase the pool of master trainers for LAC training. Prior to the development of this scale-up strategy, the state had only 6 master trainers for training of LACs. And with the guided effort of the scale-up team or the resource team, the pool of trainers were increased to 20. And also, they trained 149 community health extension workers on provision of long-acting reversible contraceptives, that is the implants, across the state. Some of the key challenges that we observed was that the resource team did not have the total decision-making authority in order to act on some of the recommendations in the scale-up strategy. And by this, the Commissioner for Health was the final authority in making some of these decisions. And so the resource team would have to revert to the Commissioner for Health or the Minister or the leadership of the Ministry of Health in order to be able to take action on some of the recommendations. And of course, because of this need to refer or to defer to authority, some of the activities did not go as planned or as fast as was planned. While the resource team was carrying out the activities, and the Ministry of Health identified the role of the resource team in scaling up family planning services, the leadership of the Ministry of Health at that time, the person of the permanent secretary, actually proposed to expand the scope of the resource team to scale up all health interventions. We did recognize the need to possibly expand the membership of the resource team, because at the time we were constituting the team, we focused on family planning, but the leadership of the ministry was actually willing to do that. And we're in the process of getting that done. However, because at that point in time, there was a change in government and there was a change in the leadership of the ministry, the permanent secretary was transferred out of the ministry. And so we could not facilitate that process because the new ministry, permanent secretary of health, was not in medical personnel. So we're trying to get him to be acquainted with what had been going on, starting from the beginning, starting the process from the beginning, and then before, and at that time the project had rounded up. Also, in terms of taking leadership and ownership of some of the activities, the government needed support, for some of the activities like the resource team meetings. So that also was one of the challenges, and one of the way out that we proposed to the government was to integrate some of these meetings in already existing meetings. Like the Cross River State had a partners forum, and so get some of these meetings to also serve as a meeting for the resource team members to meet and deliberate on some of the activities. Some of the lessons that we learned as regards sustainability is to integrate the resource team activities of the resource team, in already existing Ministry of Health committees. The Ministry of Health has a lot of committees that currently exist. So we started discussing with the government, with the Ministry of Health leadership, to identify a committee. And what we identified was the Core Technical Committee, which is actually a mirror image of the Reproductive Health Technical Working Group at the national level. And the recommendation was that the resource team, scale-up resource team, which was supposed to be an expanded health scale-up resource team, should be a subcommittee of the Core Technical Committee, so that this could engender sustainability. Also, we also noticed, or we realized, that commitments of funding to scale up activities is critical sustainability. Cross River State at the time were able to get the government and the stakeholders to commit funds from the Saving 1 Million Lives project that is funded by the government of Nigeria. So the family planning component funds were committed to continue to train CHOs, on provision of LAC, and to continue to scale up tax sharing and tax shifting services in the state. Thank you very much.
And thank you, Dr. Yemisi. We very much appreciate your taking time to share the Cross River State experience and your learning with participants in today's webinar. Whoops, sorry for the background noise. I am next pleased to introduce Dr. Alexis Ntobona, who is a medical doctor trained in obstetrics and gynecology at the University of Kinshasa in the Democratic Republic of Congo, DRC, and also in public health from San Diego State University. Dr. Ntobona has held many senior positions over the years, including head of community medicine at the SPH in Kinshasa and at the World Health Organization Regional Office for Africa, where he was a regional advisor for safe motherhood. Subsequently, Dr. Ntobona moved to WHO headquarters in Geneva to work with the Department of Reproductive Health and Research.
Thank you, Laura.
Okay, Alexis, over to you. Thanks. Go ahead. Oh.
Thank you, Laura, for your introduction. Before focusing on DRC, I would like to remind our listeners that the call for a paradigm shift towards systems thinking dates back to the late 90s and early 2000s. This movement entailed a great deal of deliberate efforts to help gradually move away from that pitfall of what is often called boutique project approach. We have come a long way, but resistance still exists. In the case of DRC, however, the clear guidance that we received from the Ministry of Health at the very first briefing meeting for the preparatory phase of E2A's work reassured us that this call for a paradigm shift had indeed trickled down and was very welcome. As an illustration, here is a quote, a quite bold statement from one of them. I quote, "You know very well how pilot projects operate. The hand that gives is always above the hand that receives. The consequence is that pilot projects kill programs. Make an effort so that this is not the case again." And that was exactly what E2A team was poised to achieve. From the policy advocacy perspective, the mindset shifting process was one milestone ahead, and we knew from that moment that the question here was no longer why do we need to change, but rather how to make changes happen. Thus, E2A work in DRC started off on the best footing because we had two advantages. First, we received a mandate from the Ministry of Health to do things differently. And secondly, the guidance from EXPANDNET WHO to this end, namely the tool on beginning with the end in mind, was also readily available and being applied in another E2A project in Kenya and Uganda. As a result, for the initial steps in designing the initiative, there was a lot of enthusiasm in undertaking a government-led participatory assessment, the first of this kind, which was immediately followed by an intervention planning involving key stakeholders at the central, provincial, and health zones level. This also entailed carrying out a set of adaptations to the original approach tested in one health zone in South Kivu to ensure relevance and best fit within the existing socio-cultural and institutional setting in the scale-up province of Kasai Central, Lomami, and Lualaba. As many of you may have noted, in reference to the beginning with the end in mind, these processes correspond respectively to Recommendation 1, engage all key stakeholders from the start. Recommendation 2, ensure relevance of the proposed innovations. Recommendation 4, tailor the innovation to the socio-cultural settings and institutional settings. And recommendation number 6, testing the innovation in a variety of social, cultural, and institutional settings where it will be scaled up. In the years that followed, one fundamental factor supporting E2A's successful implementation of phase 1 and 2 of the initiative has been the effective cooperation among all key stakeholders at all levels, which helped build country ownership and a robust and cohesive resource team that supported major organizational changes such as, first, E2A project team playing a facilitative role with government counterparts at central and provincial levels. Second, establishing a technical advisory group at central level to guide and monitor the implementation of the testing phase, resulting in improved coordination across relevant Ministry of Health programs. 3, promoting continuous learning and information sharing for the resource team across all levels. And 4, towards end of testing phase, using the EXPANDNET WHO tool, 9 steps for developing a scaling up strategy to chart a clear roadmap for recommended priority actions for subsequent scaling up efforts, possibly with other interested parties throughout DRC. Obviously, there were many challenges, but the major one that prevailed throughout this implementation period has been difficulty to maintain the stability of the resource team, wherein the capacity for scale-up had been built, mainly due to high mobility and staff turnover across the health systems hierarchy. This included turnover among both government and technical support agencies. As a result, the momentum for tackling the critical scale-up phase 3, that is, managing the scale-up process, has gradually diminished. Nevertheless, we strongly believe that E2A's legacy for beginning with the successful scaling up in mind still continues, because E2A helped facilitate a process that created a timely opportunity where health systems professionals gained hands-on exposure to fundamentals of a scale-up mindset shift. Beginning with the end in mind is not just a slogan, it is doable and it worked. Second, build the evidence base for applying a systematic approach to scaling up for successfully tested interventions. And hopefully, we hope that new opportunities, window opportunities for action will open again very soon. And thirdly, and finally, worked with the existing health systems and structures where involving field-left staff enhanced adaptive management of and creativity. Thank you.
And thank you for sharing that careful analysis with us, Dr. Ntubona. As a longtime founding member of EXPANDNET, E2A truly benefited from your contributions to building capacity for scale-up in several countries over these years. Thank you. Now, I'm very pleased to introduce Trish McDonald from the United States Agency for International Development, USAID, who has served as a Senior Family Planning and Reproductive Health Technical Advisor in the Office of Population and Reproductive Health at USAID. As Technical Manager for E2A, Trish has been instrumental in advancing E2A's multi-country work on systematic scale-up since the project's inception. Today, we're thrilled to have Trish with us to share her unique perspective on how we can all work to fill gaps in systematic scale-up processes, both now and into the future. Over to you, Trish. Thank you.
Thank you, Laura, and good morning and good afternoon to everyone. I'm happy that you could all join us today to share this exciting discussion on systematic scale up. I'd like to reflect just a bit on some of what E2A has done, what they've learned and shared about scale up over the past 9 years, and how this applies to continuing the journey of scale up in our future work. Next slide, please. Over the life of the project, E2A has introduced and scaled up evidence-based and high-impact practices, a few of which you've heard about in the presentations on Niger, Nigeria, and DRC. In each country where E2A introduced an evidence-based or high-impact practice, there have been local adaptations to fit with the country context. This doesn't mean that there's been a move away from fidelity to a particular model or approach, but everything does need to be adapted locally. So building upon several of the high-impact practices, for example, postpartum and post-abortion family planning, E2A adapted these to the unique needs of youth and expanding their access to a wide range of contraceptives, including LARCs. While working with the leaders and managers and the policy practices, they actively engaged youth in these roles to shape their development as leaders and their participation in advocacy for policy change. When the Family Planning Training Resource Package was adapted for pre-service education for nurses and midwives, it incorporated youth-friendly materials from the implementation activities for post-abortion care and postpartum family planning. Next slide, please. When we think about scale up, we need to think not only about what makes the intervention successful, but also what makes scale up successful. By planning for scale up, when piloting a high impact practice locally, it's also important to understand the settings where the scale up will take place, so that local leaders from these scale up sites are engaged in the resource team, and the interventions can be adapted to the local context and matched to the health systems and administrative systems where they will function. Next slide. Learning is key. One of the critical roles that E2A has played is to monitor and document the steps and processes involved in scaling up. And while learning is a key, sharing is also a key part of the scaling up process. As we build the evidence base on scale up through publications, briefs, webinars, and other venues, it has a multiplier effect in helping others to support systematic scale-up approaches in their own programs. The evidence on the interventions themselves can be used to update existing HIPs, the high-impact practice briefs, as well as to generate new high-impact practices. The evidence base is really important and an important contribution that your programs can provide. Next slide, please. The community of practice on systematic approaches to scale up has been, and still is, an essential means of sharing, learning, and elevating global discourse around scale up. For example, the community of practice has delved into complex issues such as sustainability, adaptation, while still remaining some fidelity to the intervention, and the relationship of scale-up to implementation science. By collaborating across sectors, the learning within the community of practice has transcended technical interventions and has been working to enhance the science of scale-up. Next slide, please. One of the key learnings is that scale-up is harder and less glamorous than implementing something new on a small scale. And you've heard our presenters mention this in their presentations. There can often be a tendency to want to implement quick fixes to achieve quick wins, but that does little to improve the systems that are needed to sustain the interventions when the project is over. One of the most important aspects of scale-up is to listen to and respect the government's role in guiding the scale-up process. They generally have a good idea of what needs to be done and should be supported when it's needed and in a manner that's helpful. The government and the resource team are the ones that maintain support for scale-up once the project is over. Next slide. So as we look to the future of Scale Up, donors have a key role to play by building Scale Up into their grant solicitation and grant management once the projects are awarded. At USAID, we've been building in institutionalization, Scale Up, and sustainability into more and more of our global health solicitations. Scale Up requires, as we've been hearing, a new way of working or a paradigm shift, as well as a mindset shift, to consider Scale Up for every intervention that's introduced and implemented. After all, the reason for introducing new interventions is to have greater impact at the program level. And the way to get there is to start planning for and supporting Scale Up from the outset. In other words, begin with the end in mind, and then see the Scale Up process all the way through as far as your project timeline permits, and ensure that you've built the capacity and commitment of others to provide the ongoing support. This will also necessitate some new approaches to monitoring, measuring, and documenting in order to capture the processes as well as the outcomes of both the intervention and the scale-up process. It's also helpful to capture the cost of the implementation in order to project the financial resources and advocate for them to accomplish the systematic scale-up that's intended. It's important to build on what we've already learned about implementing the technical approaches or the high-impact interventions, as well as what's been learned about supporting systematic scale-up processes towards achieving sustainable results. There's no need to reinvent the wheel, only to help improvement. So the last request is to please share what you've monitored, documented, and achieved in your programs, and what you've learned about Scale Up to benefit the entire global community. We can learn together in this process. In closing, I'd like to say a word of thanks to E2A's partner EXPANDNET for their incredible support for Scale Up throughout the life of the project. EXPANDNET has been extremely instrumental in supporting each of the other partners on the E2A project. That's Pathfinder, IntraHealth, MSH, and PATH, as they've introduced, adapted, and scaled up evidence-based and high-impact practices. And they've also provided leadership in the community of practice on systematic approaches to scale up. This has truly been a remarkable contribution and partnership that's benefited many countries along their journeys to achieving better outcomes for family planning and reproductive health through scaled up and sustainable programs. So thank you. And now let me turn it back to Laura to guide the Q&A discussion.
Well, thank you so much, Trish, both for those recognitions, but also for the incredibly insightful reflections looking back on these 9 years of experience, and for recommendations for all of us to seek our way forward and continuing to build on the momentum for scale up that we're generating, all of us together. So now, as an immense number of very interesting questions have been coming in from both the Q&A and in the chat, and it's almost impossible to decide where to begin. But let me start by posing a question from our colleague Trinity Zan at FHI 360 about the question relates to the resource team and how we're defining membership in the resource teams. And if we don't have the right level of decision-making power, what can we do? Maybe we need to think more strategically about stakeholder and power analysis in forming the resource team. So I know that Yemisi and Regina can contribute on this. And I also want to say that unfortunately, Dr. Antibona couldn't join us for the Q&A, but we have all our other panelists here. So Yemisi, why don't you try to address this question and Regina can pick up.
Thank you very much for the question. Yes, it's important that a stakeholder analysis is done, which we did at the time we were constituting the resource team. But some of the dynamics of government in a country like Nigeria is that we have change in leadership, and change in leadership and change in government comes with some changes in administration. And so prior to now, some members of the resource team, the positions had some level of autonomy or authority. However, changing the government of Cross River State, necessitated some changes, and so some of them could not really exercise this authority. There was another layer that was added, to the level of authority, which happened, in the middle of the process. So yes, I agree with you. Analysis should be done, but sometimes with the government you're dealing with, there are also changes that occur in the process of implementation.
Good, Regina, thank you, Yemisi. Regina, do you want to weigh in on that one, or should we move?
Yes, no, absolutely. Just one quick thing, because I know that we have a lot of questions. So just first agreeing on what Yemisi was saying, but more than that, I think that when we think about the resource team, we have to think about the range government side. They will be like having more, faster shifts that we cannot control. But we are also working with civil society organizations. In the case of Niger, for instance, one big excellent example was working with the youth, the young students. So they were the ones that were throughout the project with us. So this creates some kind or somewhat stability in the resource team, because they were also capacitated to be part of the resource team and take over during these moments that were having government changes to keep over the project. So I just wanted to highlight the fact that when we are thinking about a resource team, we do need to be opening our eyes to engage different levels of the society, meaning governments, local organizations, community organizations, international NGOs, and therefore we are trying to keep this, keep running with the resource team.
Great, thank you. So another question from Ronnie Lovich relates to a tension between scaling up a predefined approach and the continual need to update knowledge and skills to address needs as they evolve and become better understood. So this question very much relates to adaptation. And Regina, maybe you could talk a little bit about how adaptation played an important role in the work in Niger. And Yemisi, also, I'm not letting you off the hook because this question was actually posed to you. Panelists are asked to comment on good practice for ensuring approaches are up to date while aiming for scale and coverage. So Regina, why don't you start us, and Yemisi, you can pick it up.
Sure, and I think that I will take the opportunity and also trying to answer to Abby's question. Abby
Yes.
Winsco. Yeah, he asked us about capacity building, how we can address this element, which sometimes is not so well funded. So, and this is the point that I want to make. I mean, when we, in our experience in Niger, first, I mean, as I mentioned in my presentation, since the inception, all the different stakeholders were part of the process. So we really start from the scratch, the project, the planning, as I was mentioned recently, throughout the process, young people were with us. The youth were being capacitated to be part of it. So capacity building was not a separate element of the scaling up and adaptation process. When we think about scaling up and adaptation, and they have to come together, we also think about capacity building. We also think about how to really build this resource team, how to make them being the owners of the process, which requires technical support, which requires technological supports, but also require getting together all this information, documenting this information, documenting the experience, and bringing this back to them to validate this documentation. So it's really an ongoing back and forth process all the time, where throughout this process, we are building capacity, we are increasing ownership, we are increasing the possibility of institutionalizing the practice, and having government taking it over, but not only government, all the other stakeholders. So to your point, the adaptation in Niger, what we did is that, of course, when we are thinking about scaling up, we have to include the context. I mean, that's not possible to think about any practice that is out of the context. So we usually, through the scaling up approach, we do a landscape analysis of the context, and on this, we start developing the strategies that includes the methodology of scaling up, but also adapting the process. And in Niger, we went kind of like in a full cycle, and we were able to, after having scaling up the approach, which was the ULC approach, which is a youth, very comprehensive approach to support reproductive health and HIV prevention with adolescents. We also were able to make a big shift, and E2A supported that as well, using the same approach to a completely different youth community at the rural area of Niger. And for that, we also counted with youth to do that. So youth were capacitated to work at community level, very remote community level, at very remote community level, to adapt the project. And it was almost a kind of a different project, but the principles were the same. So this is for me what is the most important thing. When we are thinking about scaling up an adaptation, we are thinking about an approach, we are thinking about principles, we are thinking about the methodology, we are thinking about the technical capacity building, and we are thinking about engagement of different stakeholders.
Great, thank you. Yemisi, let me pose you a different question now. Can you, Ramadan Rob Karunda is asking about if you could describe the process you undertook to get buy-in from the Ministry of Health so that they would integrate the resource team activities into routine meetings and their work. Can you talk a little bit about that?
Okay, thank you very much. So we had the Ministry of Health also being a part of the resource team. We had key stakeholders from the Ministry of Health. And so we regularly documented the activities of the resource team. And these documentation were communicated to the leadership of the Ministry of Health. So they kind of saw the progress of the team. And so we also engaged with the Ministry of Health on a regular basis. We have review meetings, as implementing partners in the states, where we discuss different aspects of projects that were going on. So it's at these meetings where we're discussing some of these activities that, recommendations come up, strategies come up, how to better adapt and improve what we're doing. And so it was those discussions that we engaged with the Ministry of Health leadership, in particularly the Permanent Secretary. Just to answer another question that asked us why we're engaging with the non-technical Permanent Secretary. The Permanent Secretary at the time of the project was a doctor, was a technical person, and he was quite informed, was part of the training at the startup of the resource team. He had all the information. It was about 2 months to the end of the project, 3 months end of the project, that there was a change in leadership. So we didn't engage somebody that wasn't technical throughout the process, for the whole part of the process. And so we engaged with the Ministry of Health leadership. At the time, it was the Permanent Secretary, because the commissioner at the time was not on seat. The old commissioner had gone, and the new commissioner had not been replaced. And it took almost a year to bring in the new commissioner. So the highest level of authority at that time was the Permanent Secretary. And so we were engaging with him to see how we could integrate some of these activities into existing meetings. And we agreed to include it in the agenda for the meeting so that these issues can come up and can be discussed at the previous meeting. So those are some of the steps we took to engage the Ministry of Health about integrating some of the activities of the resource team.
Great, thank you. So there's a question here about how projects are often not funded for capacity building. And the listener wants to know whether we have any advice on how to address this, whether using advocacy, trying to identify follow-on funding. I don't know, Trish, would you be able to try to address this in a moment or two? We're running out of time.
Thanks, Laura. I think that's a kind of a tricky one. We do, in most of our programs, provide funding for capacity building. Sometimes additional funding is needed to provide for capacity building of, for example, the resource team, which is outside the capacity building within a specific intervention. And I think this is part of the learning curve that donors are in as well, as we build this more and more into the programming that we do. So I think that's a good thing to talk to your project managers about, if it's not there, about what's needed and the estimated cost for such capacity building activities. Thanks.
Thank you. And that's a perfect recommendation to close the Q&A with. And I hope it was clear from today's presentations that E2A really sought to catalyze the paradigm shift that we were talking about at the outset, and that working with a scale-up focus in countries and global level has really yielded a lot of important learning, as we hope the webinars conveyed. As mentioned, we plan to follow up the meeting by providing the recording, so we hope that you'll share that with other colleagues and that they'll be scaling up resources there. And as mentioned, those who may not yet be signed up for the Scaling Up COP will include that link. So most importantly though, we do hope that your commitment and your resolve to work systematically on Scale Up is strengthened by your participation today, and that you'll leave here knowing there are resources to help with the many tasks that are associated with successful Scale Up. And we, as Trish was saying, we do hope that you'll share your learning out to the global community and with EXPANDNET and Pathfinder and others, so that we all can benefit from what you're learning, and that nobody feels like they need to reinvent the wheel. So on behalf of EXPANDNET, we owe E2A a huge debt for being such a trailblazer in the area of widely applying systematic approaches to scale up. And so we thank them for that, and we thank our wonderful presenters for sharing their learning and insights. They've not only made key contributions in their technical areas in family planning, reproductive health, but also with these efforts to build scale-up capacity at the country level. And lastly, I want to thank all of you for finding time to be with us today. We wish you all the very best for your and your family's health, for your work, and for our global community. So thank you all, and please take good care. Thanks. Bye-bye.